and who introduced the concept that diseases are caused by the germs, and he was the one who introduced bacteriology as a science. And naturally, he was a pioneer of many vaccines. That was the importance. So these are various hazards. Again, we have just talked about it. So hepatitis B and C, staph and strep infections, various bloodborne pathogens are there, and new ones are coming up. Recently, you must have read in the newspaper. Today's newspaper said there is a fantastic Olympic swimmer, winner of 6 gold medals, Thorpe, and now he will no more be able to swim. The reason is he contracted some infection while doing his surgeries. It was there, I read it in Today's Times of India when I was traveling in the morning. So such organisms can be there. Latex, we already talked, various chemicals. Mercury is another thing. I mean, we still have this where mercury is used in thermometers, blood pressure apparatus, and many other apparatuses. So it can also be absorbed through skin. So it is also a risk for us. Stress, I mean, whatever we may talk about it, it's not enough. That's why you have in-house psychiatrists with you, because you know that is a problem everywhere.
He's a problem.
See, unless you become a problem, you cannot solve a problem. So all these things, they lead to various stress. And small things like, I mean, I did not go through this list, you all know it very well. Then there is this workplace violence. See, in Thane, in Mumbai, there was a fantastic hospital. We used to call it Singhania Hospital. And that hospital had pioneered this skin grafting and other things in burns areas. So, and what happened is, there was a political leader who was admitted to the hospitalized in this hospital after an accident, and he died. So his supporters got so enraged that they burned the hospital. The hospital, which was pioneer in burns treatment, itself was burned. So, and we see various, there are many news items that something wrong goes and people would attack the doctors and all those things. Because people have become very demanding. And then there is a concept of mistrust, because people behave in this area, doctors have to be defensive. Again, this medical law and medical negligence and other things have come. Because doctors are defensive, people think that doctors are doing malpractice and they don't want to take risk. And so it's again a vicious circle which goes on and on, which ultimately leads to distress and this workplace violence. So this is another person I want you to remember again, and that is Semmelweis. Now Semmelweis is a physician from Vienna Medical School. I had an opportunity to go and visit Vienna Medical School, and they have a very small area which is named after him. So he was ridiculed for provoking hand washing, but he was the one who introduced hand washing, because of which this puerperal fever mortality came down. It used to be very high in Europe in the 17th century. So he was the one who did that. And as the luck would have it, he himself died of septicemia. So these are the various measures which we take and we have to take as healthcare workers. Universal precautions, training and education, because again, what eyes do not see, what mind does not know. So we have to know. That's why training and education is important, and is also on the top. Medical surveillance, immunization, exposure controlling, identifying, monitoring and controlling the exposure, stress management, violence prevention program, all these things. Of course, for preventing infection, again, at the cost of repetition, I would say there are top 3 measures. First is hand washing. What are the next 2? Hand washing and hand washing. Yes, absolutely right. So though Semmelweis introduced it in 18th century, it still remains the most important thing, and that needs to be done. Again, you have to do training of not only doctors but also support staff, patients, relatives and visitors. That is also important in the ICs. Then again, in hospitals and medical staff also, healthcare workers also, we need to have pre-employment and pre-placement medical examinations, periodic medical examinations. If they are exposed to some particular things, we have to do that. Another important thing which has become important, which is becoming very important in the hospitals is indoor air quality, IAQ. So because nowadays everything is air conditioned and there is a central air conditioning, therefore the same air gets circulated again and again, and there is a more chance for infections to spread. So we have to be particular about it. Of course, some immunizations are available, many more I hope will develop, but whatever is available, especially hepatitis B, I am very sure now every one of you has been already immunized against hepatitis B. Then there is some immunoprophylaxis and drug prophylaxis also, which is available for some of the diseases, which of course being clinicians you know very well. And we have to take these various preventive measures, and you must be having a needle stick injury prevention program already there. Again, ergonomics is very important, and preventive measures like exercises, etc., they are also important. I did not underline the importance of stress management, which you all know very well, because you cannot change the situation, only person you can change is yourself. So we cannot reduce the stress, we cannot reduce the stresses, we can only improve our coping mechanism that we need. Florence Nightingale, we all know that she was a nurse, but very few of us know that she was also a statistician, and she was from an aristocratic family, but she was so devoted that she rejected all the suitors who came for her. She did not get married and she spent all her time in the service. And she was very passionate about hospital hygiene and sanitation. Again, I did not go into this injection safety because you all know it very well. Infection control and safe injection practices. So these are the various references in case someone wants, they are available, various guidelines. And the CDC or Center of Disease Control in US, they have a lot of material which is available on these things, and there are some books on epidemiology, there are infection control guidelines, and again healthcare epidemiology and caring for caregivers is a good publication which some of you may like. I would like to end my talk with this picture so that we know where we are, how far we have come from what we were supposed to be. Hippocrates wouldn't accept a gift even from Alexander, and what these pharmaceutical companies are doing to the doctors today, we all know it very well. So I need not go into those ethical issues. We are all very well. So thanks a lot, and I'd like to again summarize with this. If we want to achieve this occupational health services or basic occupational health, as we say, even in the healthcare sector, then these 4 steps are very important: awareness, attitude correction, legislation, and enforcement. Now, if you really see this awareness and attitude correction, they gave you the maximum benefit. 75% of the benefit comes from awareness and attitude correction, for which the cost that is needed is very low. On the y-axis are the inputs or the cost, and on the x-axis is the benefit. So what you see here, awareness itself will give you 50%. If you change the attitude, correct the attitude, it will add to 75%. Of course, you need legislation, you also need enforcement, for which you need more inputs. But these 2 things are very important with which we can start. And what happens if you really do not look at occupational health? If you do not give it importance, if you do not try to prevent the problem. So this is the last animation that I want to share with you.